So, Dr. Wazelenko. Dr. Eric Wazelenko is a clinical ethicist and retired palliative care physician. He has an extensive portfolio of past leadership and advisory roles for local, provincial, and national healthcare agencies. He's been deeply involved in policy and program creation and review within the healthcare system. He has a wide-ranging resume of speaking and teaching engagements for local, provincial, national, and international audiences. He continues to be involved in advocacy, education, and advisory roles regarding end-of-life care, ethics, and physician resource planning. Dr. Wazelenko co-created Alberta's novel Goals of Care designation mechanism adopted through the provincial health system. He co-led the development of a community-owned nonprofit freestanding rural hospice in southern Alberta. Dr. Wazelenko also served on the teams that developed the current Canadian Medical Association's Code of Ethics and Professionalism and the current Alberta Pharmacists Code of Ethics. He was recognized by the Canadian Medical Association with the Dr. William Marsden Award in Medical Ethics in 2014. Without further ado, I turn it over to you, Eric. Thank you again for being here.
Thanks very much, Michael, and thank you for the opportunity to present this talk and discussion today. Hello, everyone, and thanks for being here. I'd like to address a topical issue about public commentary, often on social media platforms by regulated professionals, and how that intersects the rights to freedom of expression with the regulation of those professionals. It's a big current challenge, and in exploring the literature, I learned a ton, including some interesting theory that I'm keen to share with you. It's a really challenging problem, as you're all aware. It's kind of polarized today. Most of us have some reasonable intuitions, I think, about how the cases we hear about in the media should be settled. But there's still lots of uncertainty, and resolution is often vexing, especially for regulators and the courts. People have always said a lot of potentially sketchy things, but for the most part, they didn't have a built-in megaphone. Now we have social media. What's said or written is automatically available to just about anyone, often immediately, and is open to polarizing and very reactionary comment. So it's all been magnified. That's put tremendous pressure on regulators, I think, especially as people might tend to weaponize what's been communicated for their own political or advocacy purposes, sometimes using regulators as their weapon of choice. So I want to spend a fair bit of my talk, and I'll probably speak for about 35 or 40 minutes, addressing some of the theory that presumably motivates our laws and our approaches to regulation, in case that helps us move forward effectively in this challenging environment. So what justifies reach into the professional lives of members regarding those members' speech? And how about their non-professional personal lives? What justifies reach into that? Are there limits to the reach of regulatory authorities when addressing the expression of their members' speech? And ought there be such regulation? In Canada, we have the right to freedom of expression. It's protected in law, and it's enshrined in our Charter of Rights and Freedoms. But why is that? Are they merely legal protections, or is there a deeper moral reason for this protection? Are there justified limits to that freedom, specifically pertaining to professionals, and for today, health professionals? So that's a hotly contested issue, and it's drawn the attention of legal commentators and the courts and regulators of professions, ethics and philosophical scholars, the media, and the public. Several high-profile cases of which you're all aware involving citizen professionals, and I use that language very specifically, are pretty well known. My comments today will focus primarily on health professions and mostly about physician practice, although there is application, I think, to other regulated professions and certainly to health professions. And for full transparency, while I've been involved as a panel member for my own physician regulatory college in Alberta doing hearings and complaint appeals, I've had no regulatory involvement in any of the cases that I'll mention. So to set the stage, I'd just like to ask some probing questions about a few examples, all of which are in the public record, and many of you will know about at least some of them. So is Dr. Jordan Peterson free to make disparaging remarks on social media platforms about non-psychology public issues or about individual people? without intervention or fear of the intervention by his Ontario psychologist or regulator, especially in the circumstance that he's not actively practicing his profession while still being registered. Should the Saskatchewan nursing regulator sanction a practicing registered nurse, Carolyn Strom, who made public comments on social media about the state of healthcare in her grandfather's long-term care home, which was also in Saskatchewan, a few hours from where she lived? Is an Ontario physician, Dr. Pouladis, who privately and then publicly objected on religious grounds to COVID public health measures that she believed offended her religion's orthodoxy, be sanctioned by her regulatory college? And lastly, should Alberta's Physician College regulate the public advocacy of a retired family physician, Dr. Robert Dixon, whose views on fluoridation run counter to the majority of public health clinicians, considering that public health is not his recognized specialty? It's not new that these types of cases exist. They are amplified in the age of social media platforms, which enable widespread and rapid dissemination, and in this age of tremendously polarized advocacy on important medical and social issues. Trying to advance my slide, Michael, and it's not working.
Maybe just hover over the bottom left corner and just see if you can get it to advance. If not, I can pull your slides up for you.
I'll get my mouse out and see if that works. Oh, okay, thank you. Did you advance it or did I?
You did.
Okay, thanks. So here's the route I want to take today. Sorry about that. Firstly, I'll briefly describe the theories that defend freedom of expression as a fundamental right for persons in democratic societies. Next, I'll lay some groundwork regarding the privileges and responsibilities that underlie self-regulation of professionals. And then we'll get into the meat of the issue, addressing some speech that is either related or unrelated to the professional's specific roles and how the courts have provided guidance in pretty reasonable harmony, I think, with a couple of relevant ethics principles. And then I'll address a few suggestions about how we might navigate the intersection of sometimes competing imperatives. Where are the reasonable limits to the reach of regulators into the professional and private lives of their members? And where are reasonable limits regarding the freedom of expression for health professionals in a pluralistic democratic society? So I'm going to make 5 claims. First, freedom of expression is important for moral reasons, and so it ought to be protected in fundamental law in the ways that it is in democratic societies. Second, the privileges and responsibilities inherent in being a health professional confer a special duty on how we express ourselves, certainly how we conduct ourselves in the professional environment, but sometimes even in the private environment. Next, we ought not hide behind the law's protection in an unreasonable way when we discharge our duties ethically, even in our private lives. Next, claim that regulators ought to be careful and measured in how they utilize their power, constantly alert to the risk of overreach, and that includes the issue of speech that's unrelated to the professional's work. And lastly, that there are ways to help navigate the challenges in meeting what are sometimes competing imperatives, including very diligent attention to charter analyses when complaints focused on freedom of expression do arise. My first claim is about the moral nature of freedom of expression. To dissect this, I have to explore some theory about the justifications underlying it. Freedom of expression is really a better and more encompassing term, I think, than freedom of speech, but I'll use them interchangeably, and most people do. So it's protected in constitutions throughout democracies. In Canada, it's enshrined in our Charter of Rights and Freedoms, and we often speak quite casually, I guess, about this right as inviolable and overriding. I know I'm guilty of quoting the right in a sort of passing way. Well, of course, there's freedom of speech. without really properly understanding its depth. Of course, it's not a completely unfettered right. But our courts have said that there are only very limited circumstances in which the right to freedom of expression is allowed to be frustrated. So, why does it hold such a foundational place in our society? Well, there are a number of theories, moral theories and philosophical ones, underpinning the legitimacy of freedom of expression and why it's protected in the law. Of course, what's legal isn't necessarily moral, and vice versa. But this particular right has both legal and moral justifications underpinning it. So it's claimed that there's a moral right to communication and to communicate what one thinks, as well as to hear what others are thinking. And I take it that it's a moral right because those possible actions are central to the development of human agency. In this, I think it expands on the notion of autonomy as self-determination. Autonomy, I think, rather is the reflection of the capability to determine one's own beliefs and thoughts and the conduct of one's own life. And agencies developed by learning and developing one's worldview and individual beliefs, and that's fostered by communication with others. Acting on those beliefs and views can follow as a component of the expression of one's autonomy, but does not have to. So we note that freedom of action is not legally protected, but freedom of expression is. So I'll very briefly sketch the theories that attempt to justify free speech, taken from Jeffrey Howard's writing in the Stanford Encyclopedia of Philosophy from 2024. Most theories try to justify free speech by giving nod to our interests in communicating with others. For instance, the listener theories say that our autonomy interests are promoted when we have the chance to learn what others say and think, and not just the commonly accepted views, and that's pretty important. Being exposed to falsehoods, however those are defined, and even to malicious commentary, both of which, of course, might be harmful, has some potential benefit to the development of our own agency, including the opportunity to reflect and critique, etc. So that concept is important to the legal admonition to not censor speech or sanction a speaker merely because the speech is distasteful or not in harmony with common beliefs. We also have interest in being able to express our thoughts. So that's the speaker theory. It's a deliberative interest, since through the expression of our thoughts, we can talk the matters through with others. We can try out our thinking as a method to get closer to what we might see as the truth. But both of those theories suggest that regulation of the content of speech is not usually justified. Excuse me. Now, democracy theories suggest that the legitimacy of decision-making processes within democracies depends on open discourse. Further, if we act to restrict the expression of citizens, we're actually disrespecting their status as moral agents who are free and equal. And that's, of course, fundamental for democratic principles. In the thinker theories, by contrast, sometimes people will attempt to justify why harmful speech ought to be protected. A current prominent theory was advanced by Schifrin from 2014, and that connects communication and thought, claiming that the centrality of free speech as a foundational thing for thinking. The claim is that by talking through our thoughts with others, we'll settle on what we think. And this allows us, of course, to cooperate and meet our obligations as citizens through sincere discourse. If we're constrained by the fear of sanction, we're no longer free to share and contribute to the development of our own agency and the agency of others, nor to seek truth together. So if we want to make society better, there's not only a negative duty to not interfere with others' expression, rather there's also a positive obligation to encourage discourse, even distasteful discourse, since all discourse leads to thinking. Now, the toleration theories worry about our tendency to punish those who hold views contrary to us. And so this theory demands self-restraint against overly protecting others from exposure to any manner or all kinds of speech. Toleration of speech, it's surmised, fosters overall toleration in society. And so that develops moral resilience in society, which then has the opportunity to self-regulate regarding the impact of distasteful and even harmful speech. Another category treats freedom of expression as an instrument, primarily as a protection or a prevention against state abuse of power. So a slippery slope is created if we grant the state the ability to restrict speech in any way at all. The precedent, once it's set, allows for relentlessly greater intrusion by the state, which in this theory is seen as a harm. Consequences of greater intrusion include the risk of casting a chill on potential speakers so that they might avoid participating in healthy discourse. And that isn't just a theoretical issue. Some recent legal commentators have described the frequency of professionals that they deal with frequently mentioning that their response is now to remain silent because of that chill. Of course, that has negative consequences for society as a whole, as well as for the individual whose seeking of the truth might be blocked. Further, the speaker might not be allowed to be treated as an equal moral agent, resulting in unjustified harm to them. So in summary, as the Strom decision outlined, quoting from an earlier decision, freedom of expression, quote, serves three key purposes: democratic discourse, truth-finding, and self-fulfillment. Well, then what might justify any limits to free speech? A common example would be propaganda for war or speech that advocates national, racial, or religious hatred, and that might tend to incite violence against identifiable groups or persons. That's generally restricted from freedom of speech protections in international codes throughout the world. So there are two categories of constraints, both external and internal. In external constraints, what we're trying to do is balance free speech against other moral values. So that's why it's called external, because it's external to the inherent value of the free speech. An example of a competing value might be the call to uphold the equality, dignity of all persons. Apparently, moral theorists in this area say that to justify any restriction on speech, it's insufficient to merely demonstrate that there's a risk of harm being caused. Rather, and this is kind of interesting, one must show the speech is wrongfully harmful in that it breaches a moral duty that a speaker owes to listeners. Internal constraints are those which turn to values that are the foundations of free speech, not external competing values. If they're offended, we can legitimately interfere with the speech. So thinking back to the free expression theories, if certain speech causes people to not be able to engage as listeners, for instance, hate speech, their autonomy is threatened. Or if by speaking up, a listener is threatened such that the listener decides they have to stay silent, that would be another example. So let's say a pharmacist speaks up publicly, reasonably or unreasonably, about conditions at her workplace, and then is subjected to the threat of a complaint to her regulator from her employer. Her autonomy and agency interests have been impaired. Now, what if our interests as listeners, for instance, seeking the truth, are frustrated by a speaker who is deliberately lying? That's an internal constraint justification, asserting, therefore, that lying falls outside of what's protected as free speech. Sincere expressions, even if wrong or offensive, can be protected, but lying is not protected. And importantly, as a professional, lying about professional matters, about professional milieu issues, would not be protected. But there's an additional moral test that we must employ in order to justify any restrictions on speech. That is, any speech restriction must be proportionate. And by proportionate, just as in ethics language, we mean, so this is both in ethics discourse and in legal discourse, that the costs of imposing a measure, and here we're speaking about a restriction, are proportionate to the benefits that are accrued by imposing that measure, again, a restriction. So I hope we've established that there's a moral imperative to protect freedom of speech. It's not just a legal one. The instrument of that protection is the law, and it's so important to the agency of each of us as moral beings, and thereby to the proper functioning of a free and democratic society, that it is enshrined in things like our charter. So I'd argue that just as important as the imperative we each have and that our institution have to defend freedom of expression on the moral grounds described above, because in that we're all self-regulating. We're not just being subject to a rule or a law. I'll also note here that content regulation is typically person agnostic. For instance, hate speech applies to every citizen and is legally restricted, especially when it impairs the ability of another person to participate fully in society. But there are some speech acts that are regulated in a person or category specific manner. For example, lying about proven medical untruths is generally not problematic when the lie is expressed by a person who's not a regulated health professional. But it is potentially sanctionable speech when it's expressed by a health professional if it's an untruth. So it's by virtue of who the person is, i.e., their role in society and their professed commitments to society, that the content becomes particularly harmful. So let's turn now to the foundation of regulation of professionals. Regulations required so that professionals who are entrusted with certain privileges to deploy their training and skills meet society's expectations of them. Not only does society grant those professions exclusive license to do certain things, in law, to steward the law for a lawyer, to manage private finances and financial information for an accountant, to design, build, and test society's infrastructure for a civil engineer, examining, probing, and operating on the bodies of citizens who are called patients for healthcare professionals. Society also grants those professions the privilege of self-regulation. In part, that's because those professionals understand best the nuances of their professional responsibilities and activities. But mostly, I'd argue it's because we profess a certain commitment. And so it becomes our duty ourselves to maintain the highest ethical standards of our own conduct and that of our colleagues. It's the internal commitment to the ideals rather than mere rule following by an authority figure. Regulator organizations get their remit to do so via legislation, and most regulators enabling legislation tends to provide a fair amount of latitude to the regulators to define their objects or their purpose. In most cases, the broad description of their mandate is to regulate their members in the public interest, and that's the language that's used in legal language and regulation of all professionals. While doing so, they admonish their members to also not bring their profession into disrepute. Now, sometimes I think that language might sound a little bit self-serving, but I argue that maintaining the profession's reputation is not merely for self-serving or self-protection of a privileged place in society. Rather, it's so that the trust that society has in the profession is validated. From a consequentialist frame, if that trust is maintained, then someone who's vulnerable to the deployment of the profession's special privilege, and that's every patient in this circumstance, can trust that the use of those skills and resources will be in the citizens and the public's best interests. For example, it requires special trust for citizens to put themselves in the vulnerable place as a patient at the hands of nurses and physicians who marshal available healthcare resources, who have special access to patients' information about health, and who can appropriately examine or even operate on those bodies after valid consent. With sufficient trust, people can feel safe to subject themselves to the health professionals' conduct. So that becomes an overall societal good. And I think that's what we mean when we say we must maintain trust in the profession. Regulators develop standards of practice for their members' conduct arising from accepted codes of conduct or codes of ethics. Complaints brought against members of the profession are adjudicated based on those standards, which all professionals have a duty to know and to understand. So again, as health professionals, we have special privileges conferred by society. Those privileges include performing certain medical acts on other people, as well as the privilege of self-regulation. And in turn, we have certain commitments and obligations, including to promote the health of individuals and society, to treat people with respect and dignity, among many others. It follows that anything we do to breach our commitments and obligations could be subject to sanctions, therefore, and speech is included in that. So that's where regulators wrestle with complaints against clinicians who speak out about things like pandemic restrictions, the merits of fluoridation, or other issues. And of course, if we use social media to express our views, or if what we say is transferred to social media platforms by others, the effect is amplified. We also, of course, risk losing the narrative once the words are out of our lips or are gone from our fingertips in ways that social media uniquely does. I would note here, as Dr. McLeod, our registrar for physicians, and Dr. Manifeld, the recent president of the College Council, have done in a recent note to the medical professionals in Alberta, that one of the physician's roles is to advocate for things like equity, social justice, proper deployment of limited resources. In meeting this duty, we have to be particularly mindful of balancing the competing duties we have to also promote health and be professional in our language, foster trust, etc., hopefully in harmony with our duties as advocates. The Code of Ethics and Professionalism for physicians, amongst codes of other health disciplines, provides considerable guidance in this management of the conflicting imperatives for physicians. We do want our physicians and our health professionals to be able to advocate about important issues in healthcare, and we cannot be squelching that opportunity for conversation. In fact, many of the things that we've done that have been now known to be very harmful, and you can think of many examples over the last decades, have come about as change only because people spoke out vigorously in commitment to their role as advocates. So in this constant self-regulating task, we cannot hide behind the veil of the right to freedom of expression, I would contend. The right is fettered by the duties we have to society and our unique obligation to promote health, and also to foster trust so that patients feel safe under our care and in the care of other clinicians. Now, to the degree that I, as a professional, am granted particular privileges that others don't have, I hold a commensurate duty to others. So I must temper some of my own personal freedoms, which are, of course, are not completely unfettered, in service of discharging properly my privilege and the associated duties of my profession. And that's, again, a form of individual self-regulation. Now, the language of many court decisions says something like this: charter protected rights to freedom of expression can be restricted by regulators only insofar as it serves regulators' central objective, i.e., regulating in the public interest. There has to be a clear path to that objective. They use the word nexus. And if there are to be any limits on speech, they must be justified and proportionate to the public interest that is the target of the mandate of the regulator. The legal language quite nicely mirrors the way I think that we conceive of both proportionality and least intrusiveness in ethics language. So this protects against overzealousness by regulators. It also might balance out any tendency for regulators to be skewed towards what I'd call an overly paternalistic, and that's not to be critical, but an over paternalistic philosophic leaning. And that would be that the public must be protected from hearing objectionable content. So that's a particular philosophical view that's a very important thing, and that's why it's a paternalistic leaning. So think back to the listener theory discussion earlier and the development of agency through being exposed to other views. Now, the term public interest is pretty vague, and so it's subject to some, I think, confirmation bias if we don't pay careful enough attention to it. Here's a danger, as highlighted by Van Geyn. Regulators may come to what seems intuitively correct decisions, or to a conclusion that's consistent with their regulations. But if they haven't done a proper and skilled charter analysis, especially about freedom of expression, they actually might not be discharging their fairness duties sufficiently. The problem being that appeal courts, if a decision from a regulator is appealed for judicial review, would tend to be quite deferential to regulators and decisional tribunals. And that arises because the assessment test in that review for judicial review is one of reasonableness rather than correctness. And there's some important principles that are talked about all the time regarding each of those tests of reasonableness and correctness. Because the standard is reasonableness, it's probably a lower bar to meet than actual correctness in a review. So courts, as in Dore, a decision from 2012, assert that violation of the charter right occurs if the adjudicator, and I quote here, has disproportionately and therefore unreasonably limited a charter right, end quote. Further, they admonish that, quote, there must be an appropriate balance between rights and objectives, and the purpose of both exercises is to ensure that the rights at issue are not unreasonably limited, end quote. Feels to me like there's a little deference to the issue of maintaining this, what would be called an inalienable right. So here's a notion about the risks of overreach in regulation. I would say we ought not squelch criticism, debate, and contra views about medical issues. And why is that? Well, at first, it acts against the individual who's worthy of respect and freedoms as enshrined. They are a speaker, and we ought to be able to listen to them. They ought to be able to communicate their views. Secondly, it puts risks putting a chill on speech because there's a fear of sanction. Thirdly, it might frustrate the obligations of physicians to advocate for patients or for social justice or for a healthy world, for equality, for quality of services, and all the other things that we might want to advocate for as any health professional. Fourthly, it risks emasculating the truth-seeking discourse that we should be engaged in, as well as potential quality improvements. And fifthly, it risks abuse of rights by authority bodies who, to be honest, hold significant power. So in general, I suspect most of us appreciate hearing contra views. They help us challenge and assess our own beliefs. So it is a truth-seeking activity. In professional regulation deliberations, I think we should also expect the speaker of contra views, especially about impactful societal issues around health and healthcare, will include an analysis of why their expressed contra view is more credible than the commonly accepted ones. And I would say that to the degree that a community-held or official view has been developed from a place of certainty or truth or proper evidence gathering, proper analysis, unbiased reasoning, etc., the bar is higher to discredit it. But to the degree that the authority view is not well backed up with exemplary procedural and substantive rigor, the bar of the contra view justification should be set much lower. Here's a nuance to the category of contra views. Sometimes decisions for sanction might be justified by a regulator by appealing to what I would call a specific and relevant expertise criterion. This is when a clinician speaks critically about matters outside of their defined specialty. And I worry about this approach by regulators because it tends to assert that the practice of medicine and the knowledge base underlying it can be distinguished so finitely and readily between specialties. And certainly the professional responsibility to think critically and analyze and question in pursuit of truth remains with us throughout our careers about anything that we touch in the practice of medicine. The self-regulation inherent in our reflection and discernment about so many aspects of the practice of medicine extends to each of us as colleagues in the overall deployment of our commitments. Resolving that concern is the very wise guidance in the Code of Ethics for Physicians and by our regulators' reminder that we have a duty to always declare if the views we're expressing are contrary to widely accepted views, especially when the commonly held views are supported by good science. Yet regulators still have a critically important function in protecting the public interest, including fostering trust in the professions. So society ought to expect civility and high degrees of professionalism in our public discourse as professionals. And I think we can demand that speakers do not foreseeably, intentionally harm through the expression of their ideas. So what is the legitimate reach of the regulator? If the speech has a direct relationship to the member's professional role as a clinician or a teacher or a researcher, the regulator can reasonably adjudicate and potentially sanction. Of course, that applies only if there's a connection, as the courts have said, to the objective of the regulator, i.e., serving the public interest, whatever that is. But what if the speech has no direct relationship to the member's professional role? Some authors, like Van Gyn, would say that the regulator has no authority in that instance. I disagree, since in situations of commentary that may be prejudicial against certain individuals or groups, harm might ensue to those individuals or groups. And that goes against the trust that any potential patient needs to have in the clinician in order to be cared for by the physician. Here's an example. So let's say if I'm a physician, I say publicly that anyone who believes in religion is simply stupid and should not have credibility about anything they do or say. If I say that, how can one of my religiously adherent patients or a potential patient have the necessary trust to be? So back to the theory about internal and external constraints. If another important societal competing value overrides, and depending on all the relevant contextual features or factors, the speech conduct can sometimes be sanctionable, and that's an example of an external constraint. But if the speech harms the agency, integrity, and ability of the person who's the target of the speech to participate in society and discourse, the speech conduct can sometimes be sanctionable justifiably as an internal constraint. Slide 16, Michael, please. So the tension remains between our charter duty to protect freedom of expression and finding proportionate balance in the objectives of regulation of health professionals. What might we consider to help manage this ongoing tension? First, the courts have been clear regarding the tests and the standards that must be employed in adjudication and in the review of decisions arising from complaints. But despite this, we witness what some commentators have viewed as inconsistencies across the country in adjudication decisions or between types of regulators. So here's some things we might want to consider, and I'd categorize my suggestions in several buckets: prevention, assessment and intervention, and quality review. In the prevention bucket, I like that regulators are providing proactive guidance to members and that they sometimes contextualize for members the results of discipline decisions as a means of relevant education. And that's particularly important because the decisions, having participated in some, I know are really often turn on some very, very fine nuanced points of law or of the regulations and codes. And so contextualizing that for members and saying, how does this apply is really important. I suspect that much more regular attention should be paid to the issue of professionalism and freedom of expression in training curricula. Schools for all health disciplines, in practicum, in residency training, and in CPD or continuing professional development programs. Didactic, but also deliberate scenario-based discussion done regularly would serve the trick. That focus would assist trainees and clinicians in the skills and awareness that they need about how to balance competing ethical duties related to speech expression. The world has changed. Rearguard actions are not as sensible as getting out in front of this pervasive and ever-changing issue. And now we also have a very substantial influx of clinicians from other places in Canada and from around the world. Deliberate training around this issue should be part, in my view, of the onboarding experience. In the category of assessment and adjudication, regulatory colleges, for instance, the College of Physicians and Surgeons of Alberta, have indicated a willingness to consider their enabling legislation. Currently, the CPSA, for example, is required by law to address in some consistent way every received complaint. Perhaps instead, another stream could be developed by all regulators to deal with complaints specifically about expression. In this stream, particular expertise in charter analysis would be brought to bear for complaints directors and adjudication panels. Perhaps that expertise, which is a specialized expertise, could be shared amongst regulators because each one doesn't get a lot of these kinds of complaints enough to have that expertise potentially in-house. That approach might be fairest to complainants and regulated professionals because it might assist in elevating quality and consistency across regulators and across jurisdictions. And I suspect it would probably make the work of judicial appeal easier as well. Regarding quality review, I'd note that case law and subsequent legal commentary provides really valuable real-time feedback for the public, but for professionals also, and certainly for regulators. Appropriate data monitoring of regulators' work in the area of speech regulation will inform the practices of regulators of all health disciplines and across all jurisdictions. And then quality review of the mechanics and the results of assessment and adjudication of complaints in the area of speech regulation makes all those practices the most defensible they can be. And when we're subject to the authority of a powerful body like a regulator, those decisions do have to be defensible, as do the processes. In this way, society and courts and professionals can know that the task of harmonizing freedom of expression rights and the objectives of regulation in the public interest is done in an exemplary manner. And finally, I'd ask, how do we know that we have this balance correct anyway, and in accord with public expectations? Kozareva and her colleagues in 2023 published an interesting paper that addresses research about what the public thinks about freedom of expression, misinformation, and content moderation. Perhaps there's important value in fostering insightful research specifically for the Canadian content. I think their paper was from the US context. So the Canadian context is important for us, and we should better be able to understand how our society views the harms instead of presuming the harms. So I've not suggested in this talk resolutions to the cases I mentioned at the outset. That was not my purpose. I hope, though, I've provided some background insight that will help us navigate the tricky issue of freedom of speech and regulatory reach. Michael, if you could go to slide 17 and then 18, here are some references to consider and a list of commentaries. I can provide you with the full citations if you email me, or I can send them via Carol if you contact her. So thanks for your attention, and I'm happy to have some discussion. I hope I've kept it to about 40 minutes or so. Over to you, Michael. Thank you.